It's been a common theme this winter. Seemingly everyone is getting sick. Well, one illness that we're seeing alarming numbers, though, is of something that you don't hear about much. Cases of tuberculosis are on the rise. For those who are unfamiliar with tuberculosis, it's a bacterial infection of the lungs. It can spread easily through the air if someone coughs, sneezes, or just even breathes on you. Health officials say the state saw at least 250 cases in 2024, the most in nearly 15 years, and it's a trend that's carried over into the new year. We've even had a few cases right here in our region. For instance, last year, a student in Columbus County came down with the infection. So, what's behind the dramatic increase in cases? Well, difficult to pinpoint the cause. Even more troubling, it can be hard for people to even know they've got it in the first place because a person who's carrying the bacteria may not even show symptoms.
It's one of our more infectious conditions, which is why when we find somebody who's got active tuberculosis, it's important to have our local health departments investigate around that person in their home, in their workplace, and see who else might have been exposed.
If you do get TB, it is treatable. Doctors say you should not be alarmed about the rise in cases, but worth being cognizant of and know the risks, signs, and there are symptoms that you could get, like a persistent cough and chest pain as well. Flu cases also on the upswing. Safe to say you probably know that. It is really tough to find someone who doesn't know someone who's been battling flu. Cases, again, the highest they've seen in more than a decade right now. That's according to the CDC. So let that sink in for just a minute. 117 people in North Carolina have died this flu season, which peaks this time of year. If you want to go rush and wash your hands, well, right now I don't blame you, that's for sure.